This is video number 3 of cancer and HIV. And I wanted to go back to this slide on spiritual needs and once again reiterate the stages of grief. You don't have to be dying or have someone die to grieve. You can grieve the loss of anything, including the loss of your hair or your lifestyle or whatever. So just remember the stages of grief: denial, anger, bargaining, depression, and acceptance. And try to help the patient through each one of those stages. 8 million cancer survivors in the United States today. The number of people who have survived 5 years or more has increased significantly, thank God. Get regular checkups. You want to tell your patients that they must seek follow-up. They'll be coming like every couple of months. Then they'll be coming every 6 months. Then they'll be coming once a year. You want to explain to them to be alert for any signs and symptoms of return. They need to be tested for other cancers. An example would be if you have breast cancer and you have radiation, you're more susceptible to lung cancer, unfortunately. Have good healthy habits, nutrition, exercise. About 80% of cancer patients return to work. And support groups are amazing and can help. All right. Next couple of slides are in-class activities that we can work on together when we're together again. There's the little case study here and some questions, so you can look through those, and we might go over those in class. And now I'm going to talk to you a little bit about HIV and AIDS. In order to have AIDS, you start with HIV. HIV is a virus, and it converts to AIDS, which is acquired immunodeficiency syndrome. In other words, the virus eats away at the immune system until it finally wins. It was first recognized in 1981. That is the year I graduated from high school. However, they believe that there may have been cases as early as the 50s and 60s and 70s that were probably diagnosed later and diagnosed as cancer and not AIDS. Just a little trivia there on this horrible disease. AIDS is I shouldn't even say AIDS is transmitted. I'm going to say HIV is transmitted through sexual contact, blood and body products, transplanted tissue, IV drug use with shared needles, transplacental, perinatal infection. So that means if the baby is born vaginally, the baby can get it. It's transmitted in breast milk. It's not caused by casual contact, not through the air, not in urine, tears, saliva, cerebrospinal fluid. To date, there's no evidence it can be transmitted this way. When someone bleeds, let's say they get cut and they're HIV positive and the blood falls on a surface, the virus will die in less than 5 seconds. So unless somebody bleeds right into your open wound, chances are you wouldn't get it. So take that in mind when you're taking care of a patient who's positive for HIV. You're not going to catch anything more from them if you use standard precautions like you're supposed to. Back in the day, the only people who got HIV, or at least that's what they said, were men who were homosexual and slept with other men. However, HIV is far more prevalent in the heterosexual population. So at some point, I hope we give up that stigma. It just hasn't happened yet. Another interesting thing about the transmission of HIV is that only 25% of babies born to HIV positive mothers have HIV, which is very, very cool. And it just shows you how really important the placenta is and how much work it does. These are details on how it spreads and what it does, but basically it infects the T cells, and then the body can't fight infection anymore. Normal T cells are 600 to 1200 milliliters cubed. Um, Somebody with HIV, if they have T cells 350 to 600, that's a good number. When they start to go 200 to 350, then that patient's probably in trouble and going to convert to AIDS. There are stages to this disease, and it's important that you know these stages. The first stage is stage 1, where they have an acute viral infection. Incubation's 1 to 3 weeks. They probably have no symptoms, or they have symptoms like mono, maybe even the flu. It ends in 2 to 3 months with blood work that shows HIV antibodies, and then it's considered a positive exam. If you have a needle stick in practice and they test you for HIV, hepatitis, all of that stuff the day of the needle stick, which is what they will do, they are not looking for you to be positive for HIV, because you would not have gotten it that fast. It would not, well, you might have gotten it. It would not have shown up. What they're doing is protecting themselves from legal action, because if you get stuck and you already had HIV and they didn't know that, then they could be paying for your HIV that you did not acquire from that needle stick. If you have a needle stick, they're also going to check the patient, because if the patient doesn't have HIV, Hep B, any of those kind of diseases, then you couldn't have gotten it from them either. So that's why they test you the day of a needle stick. I'd like to say it's for your health, but it's really not. It's more for their health. The big thing as you read through these stages, stage 2 can last for years. And the better the drugs get, the antiviral drugs, the longer this stage is lasting. And people can live pretty healthy, asymptomatic lives in stage 2. Stage 3 is when the disease process converts from HIV to AIDS. The T cells have declined too much, and the patient starts to develop opportunistic infections and what they call spontaneous neoplasms. They are very susceptible to different cancers. So all the rules that apply to cancer will start applying to these patients. How do we prevent it? This is the best treatment for AIDS, is to not let it happen in the first place. Safe sex, safe use of needles, no IV drug use, more effective early screening, treat HIV-infected pregnant women to prevent infection of the fetus. And that statistically is going quite well, and hopefully we'll get it down to where 0 babies are born with it. Complication is the AIDS-related complex: fever, fatigue, diarrhea, weight loss, night sweats. This is the patient who comes in very thin, very emaciated, and they aren't going to be with us long when they hit the AIDS arc. There are a lot of different treatments, a lot of different complications. There can be skin complications, opportunistic infections, and you can read all of these slides and the information below them. And a lot of this is kind of common knowledge. They can get bacterial infections that if we got them, we would maybe use a cream and they'd go away. But for them, a simple skin infection can result in an amputation. They can also develop cancer of the skin. Want to make sure their skin is kept very dry, intact, washed well. We're always looking for cancerous cells, neoplasms that could develop into horrible skin cancers. Keep the skin warm, not hot, when they bathe. Keep them hydrated with at least 1 liter of fluid a day. Emollients, mineral oil based, limit sun exposure. All of those things are great for the skin. These patients are also susceptible to lymphomas. And you can read all of this. You're not going to be held accountable for a lot of the screening. except to know that they use an ELISA test, and this is what ELISA stands for. There's ELISA screenings for a lot of different things, but this is a really good acronym for HIV or AIDS diagnosis. There's not a cure. Symptom management with antivirals. This drug regimen here, HART, is antiviral drugs that inhibit reproduction of the virus. And there's cocktails that people will take, and in their book they list several drugs that could be involved in a HART treatment. That is just an acronym for highly active antiviral therapy. And they started that in 1995, and it has had excellent results. Again, you can finish these slides on your own. There's some excellent information, very interesting if you have a heart for HIV/AIDS patients. I think as a nurse, we got to remember what our priorities are, and that is to make the patient comfortable, keep them out of pain, and that pain is also psychosocial. We can't judge our patients. We can't add a stigma that we're going to catch it from them. That's ignorant. We can catch more from somebody coughing on us than we can from somebody with HIV. So remember that as you're studying this. And again, you can get into all the drugs and what they do and same with cancer and chemotherapy. And that's excellent if that is your bend. But just remember that you want to focus on the nursing process. So this ends video number 3 on cancer and AIDS. You should be able to find any additional information in the notes that are below each unit. If you look down here, if you don't put it in slideshow mode, you can see that there are notes on all of the slides. Not all of them, but quite a few of them have notes that should help you. Thank you so much. Again, this concludes video number 3 on HIV, AIDS, and cancer.